Good.
Yep.
Raise your hand if you've ever had a headache. Okay, now besides just pain, raise your hand if you truly know what a headache is. Okay, well, for those of you who don't, you're in one. I've chosen 3 main types of headaches and decided to give some background information on them. First, I should tell you that headaches are more serious than they may sound. According to the National Headache Foundation, headaches lead to missed days at work, decreased productivity, inability to concentrate, changes in mood or behavior, and changes in mood or behavior. Some sufferers even miss up to a week of work a month. I will begin to inform you the causes, symptoms, treatments, and other general information about the 3 main types of headaches: tension, migraine, and cluster. The most common type of headache is the tension headache. Some causes are dehydration, drug or caffeine withdrawal, nose congestion, sleep deprivation, stress, or even dental problems. What happens during a tension headache is neck or scalp muscles tense up and they don't contract back right away, or they don't loosen right away. Tension headaches could last from a half hour to 7 days, or in rare cases, even longer. Some common treatments are Advil or Tylenol. The main ingredient in Advil is ibuprofen, which is an NSAID, also known as a non-steroidal anti-inflammatory drug. When an injury occurs in your body, your body naturally wants to make that area inflamed and cause pain. What ibuprofen does is it restrains your body from making the chemicals that cause the pain and inflammation in your body. Although ibuprofen does work most of the time, if you take it too much, your body will become immune to it and it will stop working as effectively. The best way to treat a tension headache is to obviously not get one in the first place, so you have to locate your triggers. If stress causes your headache, just chill out a little. If you're tired and that causes your headache, try to take a nap or go to sleep a little earlier. Also, stretch your neck muscles, so those contracted muscles may loosen up right away. Just find what causes them and stay clear of them. The majority of the population has had these tension headaches at least once in their life. And yeah, they're not fun, but it could be worse. According to migraine.com, about 18% of women and 6% of men suffer from migraine headaches. If you suffer from migraine headaches, there's really only one way to explain that. They suck. A lot. To put it in perspective, in elementary and middle school, I had to leave school at least 1 time a week, sometimes up to 3 early, just because of these migraine headaches. And if anyone's thinking, wow, you actually leave school early just because of a headache, just listen. Similarly to a tension headache, a migraine starts as a dull pain. Now it can either stay like that for hours or maybe only minutes. Eventually what happens is that dull annoying pain literally feels like an explosion in your head. It feels like a hammer is hitting your skull repeatedly over and over again, and all you can concentrate is on that. Also, the slightest of sounds sound like 1,000 explosions, and the dimmest of light bulbs seem like 1,000 suns. Nausea is also a big factor in migraines. A migraine can last from 4 hours to up to weeks or maybe even months, depending on your situation. You also get what's called a migraine hangover, which causes fatigue and mentally and physically the next few days. Essentially what a migraine is abnormal brain activity caused by, again, withdrawal, stress, anxiety, missed meals, or sleep patterns. It affects the nerves and chemicals in your brain and leads the blood flow in your brain to increase and the blood vessels dilate. The increased rush of blood through your dilated vessels in your brain causes the pain of the migraine. Scientists don't exactly know what causes to happen a migraine, but they do know what happens during one. Some common treatments are Advil or Tylenol migraine, or if you're feeling spontaneous, maybe your favorite soda or energy drink. Yeah, that's right, caffeine helps migraines a lot. What caffeine does is constricts those dilated blood vessels to help the rush of blood slow down. This dulls the pain and can cure your migraine. Another prescription medicine is called rizatriptan. It's a selective serotonin receptor agonist. It blocks the pain as well as constricts the blood vessels. Again, with migraines, you have to find your triggers and stay clear of them. Migraines are the worst kind of headache I've ever experienced. it's hard to imagine there's worse. The worst type of headache is called a cluster headache. It comes multiple times a day for weeks, months, or maybe years. You can have over 10 attacks in one day. The pain of a cluster headache occurs around the eye, and a common name for cluster headaches are suicide headaches. People who have had these headaches have been known to kill themselves from the pain. Females admit that a cluster headache is more painful than childbirth without epidural. That's like having a child over 10 times a day. Dr. Peter Goadsby, professor of clinical neurology, says that cluster headaches are the worst pain a human can endure. Just ask anyone who's had one. They're still not sure why they happen, but it relates to the shifts in histamine and serotonin in the brain. Histamine triggers inflammation, and decreased serotonin levels dilate blood vessels. Some triggers of cluster headaches are altitude or weather, all the way from smoking, drinking, and cocaine use. Medicines include triptans, which block the pain and restrict the blood vessels. Another medicine is dihydroergotamine. It works similarly to triptans, although it may work better. You can inject it into your bloodstream or use it as a nasal spray. Another treatment is pure oxygen. This is the most common because you can keep it bedside. Other medicines are you can use blood pressure, seizure, and depression drugs to treat these headaches as well. You can't use Advil or any regular pain reliever because by the time it kicks in, the attack will be gone. As with any other headache, you have to find your triggers. Headaches are a very large medical problem all around the world and country. They occur to almost everyone at one point in a person's life. Between the dull pains of a tension headache, the more painful pounding of a migraine headache, or the extremely painful sharp burning sensation of a cluster headache, you should now have a basic understanding of the symptoms, causes, treatments, and just a regular basic understanding of each type of headache. And remember, next time you're faced with any type of headache, don't be afraid to dabble into that monster of Red Bull.
Okay.